Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos.
Welcome to the deep dive. Just a heads up, this deep dive was created using generative AI tools. This is really to support accessibility and clarity.
Right.
But the actual content, that's all grounded in the extensive research and, well, the instructional work of Dr. Michael Jones. So today we're diving into a really critical area for mental health professionals. We're talking about navigating the tech side of things in telemental health.
Yeah, it's huge right now.
Absolutely, because, while technology gives us this amazing access to care, it can also, sometimes subtly, sometimes not so subtly, become a real barrier for clients.
It really can.
Our mission here really is to help you unpack that, to give you the insights, the tools, to understand, assess, and hopefully dismantle those tech barriers.
Turn them into pathways, right?
Exactly, pathways to healing.
We'll get into terms like the digital divide, maybe technology anxiety, and see how they actually, look in practice. So let's get into it.
It's fascinating, isn't it? How this thing, telemental health that promises more access,
can actually, ironically, throw up new hurdles if we're not careful. Like, just asking clients to use technology means that tech itself becomes a potential block.
a barrier to care right there.
Exactly. And it's not just like a technical glitch. It really demands some serious ethical thinking.
That's such a key point, technology as the barrier. And it makes me think immediately about, ethical guidelines, like the ACA code C2.A specifically.
Competence.
Right, competence boundaries, developing cultural competence. So in telemental health, that cultural competence piece has to stretch, doesn't it? It has to include understanding these tech barriers and how they connect with, well, bigger systemic issues.
Yeah, inequities.
It's not just can they use the software. It's about realizing who might be getting left out unintentionally.
Precisely, which means ethically we need systematic ways to assess technology readiness and provide training. Research, like from Reed and their team back in 2021, it clearly shows these tech challenges hit vulnerable groups harder.
Like who specifically?
Well, think about older adults, people with disabilities, those with fewer economic resources, maybe folks in communities without good digital infrastructure. It becomes an equity issue, plain and simple.
And that leads us straight into this term many of us have heard, the digital divide.
Right.
Nuri and others defined it, I think, back in 2020 as basically the gap, between people who have access to modern tech and those who don't.
The haves and have-nots of tech.
Yeah, and it often tracks right along with socioeconomic status, education, even where you live geographically. So clients maybe from lower socioeconomic backgrounds might lack reliable internet, or maybe they don't have an up-to-date device, or just the money for telehealth tech. It's basic access.
And it goes beyond just having the stuff, the hardware, the connection.
Yeah.
It makes you wonder, how do educational levels or literacy skills play into technology literacy?
That's a good question.
It's complicated, right?
Yeah.
So assessment needs to be, really non-judgmental about a client's abilities. And then you have cultural factors, generational factors.
How so?
Well, different communities just relate differently to technology, to privacy, even to healthcare itself. If there's already stigma around mental health in a culture, adding tech might just make people more reluctant.
Amplifying the reluctance. Makes sense.
And generational gaps mean we need assessment and training that are age appropriate, respecting different comfort levels.
Okay, so we understand these barriers exist systemically, which leads us to, well, how do we actually figure this out for each client? How do we assess? You mentioned technology readiness assessment.
Yes, as a multidimensional approach.
So it's way more than just, can you click a link?
Oh, absolutely.
Yeah.
And this ties right back to our ethical duties. Like the NBCC, the National Board for Certified Counselors, Standard 99 talks about telemental health service screening.
Okay.
It's basically a requirement to check if telemental health is even suitable for someone. And that includes assessing their tech literacy and access.
And the ACA code?
Yep, ACA H.4C, Technology-Assisted Services and Client Capability Assessment. It really highlights our duty to evaluate readiness and, crucially, provide support. We need to be proactive.
And I remember reading Holden and Karsh back in 2010. They talked about assessment models that go way beyond just the tech skills. They include psychological readiness, cultural factors.
That's right, comprehensive.
And it shouldn't be this separate, tech check you do off to the side. It needs to be woven right into your normal intake.
Exactly. Integrate it.
Because that shows the client right from the start that you're looking at their whole picture. It supports the relationship.
Definitely. And when we talk about assessment, it helps to think in terms of, say, 4 key domains. First is technical infrastructure.
Oh, okay. Like what?
Like, do they have a device? Is their internet connection decent? What about privacy, where they'll be joining from? Is it safe? And importantly, what's the backup plan if the tech fails?
Good point. Backup plan. Okay, what's second?
Second is digital literacy. So can the client actually use the tech effectively? What's their past experience? How comfortable are they? What do they do if something goes wrong? Can they troubleshoot a bit? Do they have anyone who can help them?
Right, their support network. Okay, third domain.
That's psychological readiness. This gets into any anxiety or fear they have about using technology, sometimes called technology anxiety. What's their motivation for telehealth? Any past experiences, good or bad, with tech and healthcare? What do they expect telehealth to be like for them?
Their mindset around it. And the fourth?
Fourth is cultural and accessibility considerations. So language preferences, obviously. Any disability accommodations needed. Cultural stuff that might impact how they feel about using tech for healthcare. And yeah, those economic barriers, again, potentially limiting access.
You mentioned culture there, and that seems critical. ACA, C.2 Bat A again, right?
Yeah.
Cultural competency in technology, multicultural competency, and technology accessibility.
Paramount, absolutely. We have to understand how different communities relate to tech, to privacy, to how healthcare is delivered.
Can you give an example?
Sure. Imagine a client from a community where, like we said, mental health issues carry a heavy stigma.
Okay.
Adding a technology requirement might just deepen that reluctance. It could feel like another hurdle, maybe even something that makes seeking help feel less private or more complicated.
That's a really important nuance. And privacy itself, those concerns can look really different depending on the culture, can't they?
Absolutely. Some clients might worry about, government surveillance or how their data is being used.
Yeah.
Or even just family members finding out they're in therapy.
Things we might not immediately think of.
Right. And these aren't small worries.
Yeah.
They need, respectful exploration and really clear info about privacy safeguards. It's all about building that trust.
Makes sense.
And don't forget family and community. In some cultures, healthcare choices aren't purely individual. Family input, community consultation that can really influence whether someone embraces technology for care.
Okay. And what about language? Clients with a limited English proficiency.
Huge consideration. Assessment has to include checking language support options like, are real-time translation services available? Are platforms bilingual? And beyond just language, what's their comfort level discussing really personal things in English versus their native tongue? Literacy levels, too.
Lots to consider. Even religious or spiritual belief.
Potentially, yeah. They might subtly shape how someone feels about using technology or certain healthcare delivery methods. It's about being open to those factors.
So once we've done this really thorough, holistic assessment, that leads us to actually getting the client started, right? The onboarding. And it's not just sending a link and hoping for the best.
Definitely not.
Our sources really point to adult learning principles, Knowles and others back in 2015. What does that mean in practice?
It means making the training relevant to them, making it practical, building on what they already know, even if it's just a little, and really supporting their sense of autonomy, their control over learning.
Okay, so how does that look, like a structured process?
Ideally, yeah. Think of it in maybe 3 phases. Phase 1 is pre-session preparation.
Before they even start therapy.
Right, maybe a week or 2 before the first session.
Yeah.
This is where you send educational materials. Stuff explaining the telehealth process, how the platform works, basic troubleshooting tips.
Okay.
And maybe offer a chance for a quick practice session. Importantly, these materials need to be in different languages if needed, and accessible formats like large print or screen reader compatible.
Got it. Phase 1, prep. What's phase 2?
Phase 2 is first session onboarding. This happens right in that first session, maybe the first 10, 15 minutes.
Okay, what do?
You do a quick tech orientation. Show them the key buttons, mute, unmute, video controls, chat maybe. But just as important, you check in. How are they feeling about the tech right now? Any anxiety?
Assess their comfort level in the moment.
Exactly. And always always establish those backup communication plans. What happens if the connection drops? Having that safety net builds confidence.
Makes sense. Prep. First session. Phase 3.
Phase 3 is ongoing support and skill development. This isn't just a one-off training.
Right. It continues.
Yeah. You check in regularly in the early sessions. Maybe you gradually introduce more platform features if they're relevant, like screen sharing or a whiteboard feature. And something we call competency recognition.
What's that?
It's basically acknowledging and celebrating their growing skills with the technology. Frame it as part of their progress in therapy. It's really empowering.
I like that. Competency recognition. Speaking of empowerment, let's circle back to technology anxiety. Brosnan's research from way back in '98 highlighted this. It's a real clinical issue, isn't it?
Absolutely. It's not just nervousness. It can genuinely get in the way of engagement, of therapeutic outcomes.
And it can come from different places.
Yeah. Fear of failure, like messing up with the tech.
Yeah.
Deep worries about privacy, or maybe they just had a really bad experience with technology before. It's legitimate anxiety.
Okay. So what are some common sources you see?
Well, performance anxiety is a big one. The fear of looking silly or doing something wrong. Privacy and safety concerns, for sure. Who else can access this session? Is it secure? And sometimes issues of control, like technology can make some clients feel less in control of the therapy space.
I can see that. Imagine you finally work up the courage to talk about something tough and then your internet cuts out.
Exactly. The frustration isn't just about the tech glitch. It can feel like a major setback, amplify anxieties. It can really derail things.
So how do we handle this therapeutically? We can't just wish the anxiety away.
No, it's about collaborative problem solving. Work with the client. If they're resistant or anxious, figure out solutions together that respect their comfort but still allow access to care.
So maybe things like gradual exposure.
Yeah, that can work well. Build skills and confidence through small, successful steps, manageable experiences.
Okay. What else?
Normalizing it is huge. Let them know. Tech problems happen to everyone, even tech wizards.
Right. It's not a reflection on them.
Exactly. Saying that out loud can really reduce shame and anxiety and ultimately empower them through choice. Give options where possible, different devices, maybe session formats, ways to communicate. Keep that sense of client autonomy alive.
Choice is key. And thinking about tailoring things, we definitely need specific approaches for different populations, right? This ties back to ACA C.2.A, again, working effectively with clients with disabilities, ensuring equity.
Absolutely critical.
Yeah.
For older adults, for instance, Ugoda and colleagues in 2021 pointed out unique challenges.
Like what kind of challenges?
Could be vision or hearing issues, maybe difficulties with fine motor skills needed for devices, cognitive factors impacting learning new tech. Maybe they rely heavily on family for tech help. Assessment needs to cover all of their past tech use, any physical limitations. It's about meeting them where they are.
Okay. And for clients with disabilities more broadly?
The key is ensuring both the assessment and the training are accessible, and that reasonable accommodations are standard practice.
So that could mean?
Well, for visual impairments, ensuring platform compatibility with screen readers. For hearing impairments, things like closed captioning or maybe sign language interpretation. For motor impairments, thinking about alternative input devices. For cognitive disabilities, maybe simpler interfaces or step-by-step guides. For speech or communication issues, exploring text-based options or other communication aids.
Tailoring it specifically. And what about clients with limited English proficiency?
Again, assessment is key. You need to understand the language barriers, sure, but also cultural factors around technology and healthcare, literacy levels in their primary language in English, and whether they have family or community support for using technology. Each piece can be vital for successful engagement.
Wow. Okay. So after all this careful assessment, onboarding, and tailored support, we need to make sure it's actually working, right? Which brings us to quality assurance. Continuous improvement.
Exactly. It's not set and forget it. We need ongoing evaluation. Are we actually succeeding in reducing barriers and ensuring access?
How do we measure that?
Through key performance indicators, KPIs. Measurable things.
Like what?
Things like, are telehealth clients completing their sessions at similar rates to in-person? How often are technical difficulties happening and how quickly are they resolved? What's client satisfaction like specifically with the technology part? How much session time are you losing to troubleshooting?
Interesting metrics. What about retention?
Yeah, comparing retention rates for telehealth versus in-person clients. Are people sticking with it? Are we keeping them engaged?
And client feedback seems crucial here too.
Absolutely vital. Ask them directly. Was the setup easy? Were the materials helpful? Did the practice session make a difference? Were instructions clear? overall satisfaction, and crucially, any suggestions.
They're often the experts on their own experience.
Exactly. Their feedback gives you actionable insights for improvement.
So what does that continuous improvement look like in practice?
It means regularly looking at that feedback, looking at the KPI data. It means updating staff training based on the common problems you're seeing. It means evaluating the platform itself. Is it user-friendly enough? Maybe optimizing it. What else? Mapping out community resources, maybe libraries or community centers that offer digital literacy support and building partnerships. And staying on top of new accessibility features as technology evolves and integrating them. It's really an ongoing commitment.
A commitment to making telemental health truly work for everyone.
That's the goal.
Okay, well, that brings us towards the end of this deep dive. As you think about everything we've discussed today, maybe consider these questions. First, how might these concepts of the digital divide or maybe technology anxiety actually show up in your specific work setting, your role? And what's maybe one initial step you could take to start assessing these factors for your clients? And second, reflecting on those evidence-based onboarding strategies we talked about and the ethical guidelines, what's one tangible change you might want to make in how you approach introducing technology-assisted services? Especially thinking about the KCREP, that's KCREP 2024 standards around counselor competence.